How's it going, guys? A medium difficulty question, hematology, step 1, internal medicine, 2CK, 42-year-old woman, 6-hour history, drooping, left side of her face, no past medical history, febrile 101 Fahrenheit, hemoglobin low, 10 grams per deciliter, should be 12 to 17.5, menstruating women, 13 to 17.5, non-menstruating women and males, leukocytes, 8,000, should be 4 to 11,000, platelets low, 100,000, should be 150 to 450,000, creatinine elevated, 1.7, should be 0.7, 1.2, and then our smear here is showing us schistocytes, aka helmet cells. Which of the most likely explanation for the findings? Let's just hop through. Choice A, antibodies against glycoproteins 2B, 3A, wrong fucking answer. First, ITP, idiopathic / immune thrombocytopenic purpura, where you're going to have classically a viral infection followed by petechiae, nosebleeds. Probably 3 out of 4 questions will be a school-age kid. 1 out of 4 will be a woman, 30s to 40s, with random bruising. So ITP, exceedingly high yield for USMLE, made lots of clips on it. You're going to do steroids followed by IVIG followed by splenectomy. If you do splenectomy, platelet count goes back up 6 months later, goes back down. Answer on NBME is accessory spleen. Choice A, wrong fucking answer. Choice B, disseminated intravascular coagulation, wrong fucking answer. So this is DIC, miscellaneous etiologies, sepsis, trauma, amniotic fluid embolism, treatment of APL with release of our rods into the circulation. So DIC is going to be a runaway effect of consumption of clotting factors and platelets. So you're going to have increased PT, PTT bleeding time, 9 out of 10 questions. Fibrinogen is decreased. You're going to have increased plasmin activity. You're going to have increased D-dimer, increased fibrin degradation products, and you will see schistocytes on a smear. In this case, wrong fucking answer. Choice C, inhibition of matrix metalloproteinase, correct answer. So diagnosis is TTP, thrombotic thrombocytopenic purpura, and the matrix metalloproteinase is ADAM TS13, so you can have antibodies against it or sometimes mutation in it. So it's a condition where you're going to get a pentad of number 1, schistocytosis, number 2, thrombocytopenia, number 3, renal issues, can be increased creatinine, can be hematuria, and then you're going to get fever and neurologic signs. So long discussion, hemolytic uremic syndrome, choice E, wrong fucking answer, is going to be simply a triad of schistocytes, thrombocytopenia, and renal issues. And hemolytic uremic syndrome is going to be when you have EHEC 157H7 or Shigella with toxin that causes damage to the afferent arterioles going to the kidney. Platelets are going to be consumed in terms of patching up the endothelium. RBCs flying by are going to be sheared, cause schistocytosis. Combination of thrombocytopenia and schistocytes is called microangiopathic hemolytic anemia. So you're going to have that triad. In TTP, you have the HUS triad plus fever and neurologic signs. And rather than being caused by toxin, as in Shiga or Shiga-like toxin with HUS, you're going to have idiopathic activation of T cells that are going to lead to inactivation of ADAM TS13. If it sounds really confusing, don't worry. I just want you to know that HUS is the triad I mentioned, and then TTP is simply add fever and neurologic signs on top of it, and you're going to get schistocytes in DIC, HUS, TTP, mechanical hemolysis with prosthetic valves, and also HELP syndrome in pregnancy, HELLP, hemolysis, elevated liver enzymes, low platelet count. So inhibition of matrix metalloproteinase is going to prevent the degradation of von Willebrand factor multimers, okay? And it's going to lead to shearing of RBCs within the vascular spaces, leading to the schistocytosis. Let's just hop to the other answers here. Choice D, mechanical hemolysis, wrong fucking answer. As I just said, you can have prosthetic valves causing shearing of RBCs, leading to schistocytosis. Choice C, ribosomal 6S inhibition, wrong fucking answer. This is going to be the mechanism of action of Shiga or Shiga-like toxin, and ultimately both of those infections can lead to HUS. Choice E, wrong fucking answer. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.